Hi guys, thanks again for coming back. I've been trying to get in contact with one of you who left a message on my YouTube channel, but I can't for some reason find the actual question on the YouTube channel to be able to answer it. So I'll have to answer it by video. So this is a message for Cristian Kabba. I think that's how you spell or pronounce your surname. My apologies if it's incorrect. You asked about the medical check and what do you need to be, or what do you need to do to be an ECA? I think that's your question. So the medical check, you go to the interview, and then you have to do a physical, and you have to do a kind of medical check in a way of showing that you can physically do the job. It's very easy. You don't need any experience about it. The physical is basically seeing if you can have a bit of stamina for 5 minutes or 10 minutes and to walk up and down stairs and things like that. I won't go too much into it because it will depend, I think, on each trust, and also I can't really give out that information, okay? But my advice is to make sure that you're fit enough to walk up and down several flights of stairs with a heavy bag, let's say. The medical check on that side, if it's the one I'm thinking you're asking about, is basically they'll show you a routine to do, which would be part of your job anyway, and you're asked to do this for about 5 minutes without stopping. Okay, so it's quite stamina related part of the job. Okay, your physical medical, for your own medical, did I do it for medical? I think it was just like general questions, you know, have you got any asthma, or you know, if you've got any medical conditions and things like that. And they also give you a blood pressure check, and there was I think an occupational health come over, but they did for me anyway. And my medical check was quite interesting actually, because my blood pressure is pretty good. My heart rate when it's relaxed is around sort of 48. And my blood pressure is pretty normal, so between sort of 120, 130 over 80. But I think I have this white coat syndrome sort of thing. So when I know my blood pressure is about to be taken, it shoots right up for no apparent reason. And I get that with my patients as well. So when occupational health did the blood pressure check, bearing in mind that the 3 hours or so beforehand on a manual blood pressure, it was completely normal. They then did the check on an automated one, and it was 200 over something. It was sky high. So I have no idea why that happened. And they said, oh, I'm not sure we can do this. I'm thinking, honestly, it was fine. You know, I was completely normal with a manual one. And then they did it again, it was lower. So whether there was an issue with the cuff, or whether there was an issue with me getting a bit sort of nervous for some reason, don't know. But that's the medical. So you have your physical before you examine it, before your interview, just to see that your stamina and general fitness is good enough. Majority of the time people can do it, even if they're overweight. They can do the job as long as they're fit and healthy enough to do, you know, up and down stairs and things. The medical side of the testing, again, can you do 5 minutes of a specific action which you're doing in your job normally? I won't go through to that. That's all part of the interview process, I think. And the medical for yourself, you know, blood pressure, past medical history, that's the only thing, really. Okay, I hope that answers your question, Cristian, and I'm apologise I can't actually reply to your actual question on the YouTube because I found it, but I couldn't get to your name and to reply because your information wasn't there for some reason. Okay, I will check back with you with another video. Thanks again for everything, and stay safe, drive carefully, and see you soon. Bye bye for now.